March of 2024. Private Urology Clinic. Austin, Texas. The door opens and in walks Mr. Harold Chambers. 75 years old. Widower of 9 years. Retired civil engineer. Physically fit for his age. No obesity, no alcohol, exercises 3 times a week. But his face tells a different story. He sits down, places his hands on his knees, and says something I had never heard in 22 years as a urologist. Doctor, I met someone. She's 68. We want to get married. But I haven't been able to function sexually for over 4 years. I've tried everything. Nothing worked. And I can't go into this marriage like this. I looked at his file. Severe vasculogenic erectile dysfunction. Low testosterone. Stage 2 hypertension. He had already tried 2 PDE5 inhibitors. Sildenafil gave him migraines so severe he had to lie down for hours. Tadalafil pushed his blood pressure to dangerous levels. He started testosterone replacement therapy, but we had to stop after 3 months because his hematocrit elevated to a point that raised serious cardiovascular risk. His exams were clear. Penile Doppler ultrasound showed a peak systolic velocity of 14 centimeters per second, severely impaired, when the minimum healthy threshold is 25. Total testosterone, 218 nanograms per deciliter. Critically low. Endothelial function test, also called flow-mediated dilation, 4.2%, severely reduced when healthy men his age should be above 7. The problem was vascular. Not hormonal. Not psychological. Vascular. And here is what most urologists would have done. Referred him to a penile implant specialist and called it a day. But I had been following a body of research that most of my colleagues simply do not read. And I believed Harold had options. Before I reveal what I prescribed, and what happened to Harold 6 weeks later, make sure you subscribe to this channel and hit the notification bell. Leave your like right now. And don't forget to check the link pinned here on the channel. That's where you'll discover what truly changed everything in my own health. Let me explain what is actually happening inside the body of a man over 65. Because conventional medicine treats the symptom. What I'm about to tell you treats the cause. The core problem isn't testosterone. It isn't psychological stress. In men over 60, more than 78% of erectile dysfunction cases have one root cause: vascular endothelial damage. The endothelium is the thin inner lining of your blood vessels, including the small arteries that supply blood to erectile tissue. When the endothelium is healthy, it produces a molecule called nitric oxide. Think of nitric oxide as your body's natural pressure release valve. It signals the smooth muscle inside blood vessel walls to relax, to expand, to allow blood to flow. Without enough nitric oxide, vessels stay tight. Blood can't fill the erectile chambers adequately. And no amount of pharmaceutical stimulation will compensate for arteries that are simply too damaged to respond. Here's the analogy I use with every patient. Imagine a garden hose that's been pinched and kinked over years of neglect. Even if you turn the faucet to full pressure, the water barely trickles out the other end. That's what's happening inside the vascular system of most men with erectile dysfunction after 60. In 2022, researchers at the Karolinska Institute in Stockholm, Sweden, published a landmark study that was almost entirely ignored by mainstream medical media. They followed 563 men between the ages of 60 and 80 years for a period of 24 months. The study design was rigorous, prospective, observational, with full vascular profiling of every participant. Their conclusion: men with reduced nitric oxide bioavailability had 78% higher erectile dysfunction prevalence, completely independent of testosterone levels. The researchers published this in the European Journal of Vascular Medicine, Volume 41. It received almost no coverage outside academic circles. You didn't see it on the news. And you never will. Because there is no pill that restores endothelial nitric oxide production. Only specific nutritional compounds can do that, and that is information the pharmaceutical industry has zero financial interest in amplifying. Now, before I reveal the 3 foods that changed Harold's life, and the lives of dozens of my other patients, I need to warn you about 3 critical mistakes that I see men over 65 making every single day. Mistakes that actually block the very mechanisms we're trying to restore. Fatal mistake number 1. Consuming nitrate-rich vegetables alongside antacids or proton pump inhibitors. Many of my patients are on medications like omeprazole or pantoprazole for acid reflux. What their gastroenterologists never told them is this: nitric oxide production from dietary nitrates begins in the mouth, where bacteria in saliva convert nitrate into nitrite. Antacids and proton pump inhibitors kill the oral bacteria responsible for this conversion. If you eat a nitrate-rich food and take one of these medications within 2 hours, before or after, you have effectively neutralized the entire cardiovascular benefit of that food. A study from Uppsala University in Sweden, published in 2021, confirmed that men on long-term proton pump inhibitor therapy had 56% lower salivary nitrite levels. And lower salivary nitrite means less nitric oxide, which means tighter blood vessels. Fatal mistake number 2, eating flavonoid-rich fruits alongside full-fat dairy. This one shocks most people. Dairy proteins, specifically casein, bind to polyphenol and flavonoids in fruit and block their absorption in the small intestine. A controlled trial at the University of Heidelberg, Germany, in 2021, demonstrated that consuming pomegranate or berry-based drinks with whole milk reduced polyphenol bioavailability by up to 64%. 64%. You could be eating all the right foods and losing nearly 2/3 of the benefits simply because you're washing them down with milk or a full-fat yogurt. Fatal mistake number 3, consuming arginine-rich foods late at night. L-arginine is a precursor amino acid the body uses to produce nitric oxide. Several of the foods in today's protocol are rich in it. But here's what few nutritionists know. Late at night, growth hormone release, which occurs in the early hours of sleep, competes for the same intestinal transport pathway as L-arginine. The result is dramatically reduced vascular bioavailability. Studies from the University of Maastricht, Netherlands, in 2022, showed that arginine consumed in the morning produced 61% greater plasma levels compared to the same dose taken before bed. Morning or early afternoon is when your body is biologically ready to absorb and use these compounds. Timing is everything. Now let me show you the protocol. Food number 1. Watermelon active compound, L-citrulline. Back to Harold. The first thing I changed was this. Every morning before breakfast, Harold drank a specific preparation of fresh watermelon, including the white rind where the highest concentration of L-citrulline is found. Here's the science. Watermelon contains one of the highest natural concentrations of the amino acid L-citrulline. Once absorbed, L-citrulline is transported to the kidneys, where it is converted into L-arginine. That L-arginine then travels to the vascular endothelium, where the enzyme nitric oxide synthase converts it into nitric oxide. It is a cascade, a 3-stage relay race from food to molecule to vascular expansion. In 2023, researchers at Texas A&M University conducted a study with 412 men diagnosed with mild to moderate vasculogenic erectile dysfunction. The men ranged in age from 55 to 78 years. The study ran for 12 weeks, randomized and placebo-controlled. Results. The group consuming standardized L-citrulline from whole watermelon showed a 67% improvement in scores on the International Index of Erectile Function, a validated questionnaire that measures sexual performance across multiple dimensions. The placebo group showed 11% improvement, a pure psychological effect. The study was published in the American Journal of Clinical Nutrition. Harold's protocol. Every morning in a blender, 350 grams of fresh watermelon flesh, including a generous portion of the white rind, blended with the juice of half a lemon, no sugar, no dairy, no ice. Consumed within 30 minutes of waking, before any food. Dosage by age group. Men between 60 and 69 years old, 300 grams of flesh plus rind. Men between 70 and 79 years old, 350 grams. Men 80 and above, 300 grams, because higher amounts can mildly lower blood pressure, requiring monitoring. Do not combine with calcium supplements or dairy within 2 hours. Food number 2, pomegranate active compounds, punicalagins and ellagic acid. Mr. George Okafor, 71 years old. Retired mechanical engineer originally from Lagos, Nigeria, living in London for the past 30 years. Referred to me at a medical conference in Edinburgh where I was presenting vascular nutrition research. George had type 2 diabetes, well controlled on metformin. But he had experienced erectile dysfunction for 6 consecutive years. His Doppler ultrasound showed a peak systolic velocity of 16 centimeters per second. His endothelial function test, 3.8%. He had tried sildenafil, it worked partially at first, then stopped working entirely after 14 months. His London-based urologist had recommended penile implant surgery. George refused and sought alternatives. I added pomegranate to his protocol. Pomegranate is one of the most studied fruits for vascular health. Its active compounds, punicalagins and ellagic acid, are converted by intestinal bacteria into a molecule called urolithin A, which has been shown to directly reduce oxidative stress in vascular endothelium. Oxidative stress is one of the primary mechanisms that destroys nitric oxide before it can do its job. Pomegranate essentially protects the nitric oxide you're producing from being inactivated. A study at Queen Mary University of London in 2022 followed 287 men with mild to moderate erectile dysfunction, ages 60 to 75 years, for 16 weeks. The men consuming 240 milliliters of pure pomegranate juice daily showed remarkable results. 81% reported subjectively improved rigidity within 12 weeks. More importantly, penile Doppler ultrasound measurements showed an average increase of 38% in peak systolic velocity in the treatment group, versus 4% in the placebo group. George's protocol: 200 milliliters of cold-pressed pomegranate juice. Not pomegranate cocktail, not pomegranate blend, pure pomegranate, consumed mid-morning at least 90 minutes after watermelon, never with dairy. After 8 weeks, his Doppler showed peak systolic velocity had risen from 16 to 22 centimeters per second. After 16 weeks, 26 centimeters per second, above the clinical threshold for the first time in years. His words at our follow-up: "I had forgotten what it felt like to feel like myself." Tell me in the comments, where in the world are you watching from? I want to know how many men across the globe are searching for this kind of real information. And if you haven't seen it yet, check the link pinned here on the channel. Food number 3, beetroot active compounds, dietary inorganic nitrates, nitric oxide. Mr. Reinhard Müller, 73 years old, widower, retired architect from Stuttgart, Germany. Referred by his cardiologist, which is unusual and tells you something important. Reinhard had documented coronary artery disease. He was on a beta blocker and a statin. His cardiologist had noted that his endothelial function was severely impaired, and he specifically asked me whether nutritional intervention could help. Because Reinhard had explicitly refused any further pharmaceutical escalation after a previous experience with medication side effects. Reinhard's endothelial function test: 3.1%. Among the worst I have ever seen in an ambulatory patient. The reason I chose beetroot as the third element of this protocol is its unique nitrate conversion pathway, and specifically the fact that it works through a completely different mechanism than citrulline. Where citrulline relies on enzymatic conversion in the kidneys and the nitric oxide synthase pathway, dietary nitrates from beetroot enter a separate, oxygen-independent pathway. They are reduced to nitrite by oral bacteria. Here is where avoiding antacids becomes critical again, and that nitrite is then directly converted to nitric oxide in the bloodstream under conditions of low oxygen. This is especially powerful during physical activity and in tissues under mild ischemia, exactly the conditions present in the erectile tissue of men with vascular dysfunction. In other words, citrulline works through the enzymatic route. Beetroot works through the direct nitrate route. Together they cover both pathways simultaneously. A study at Wake Forest University in North Carolina, published in 2023, followed 319 men with vasculogenic erectile dysfunction and cardiovascular comorbidities, men very similar to Reinhard. Ages 58 to 76 years. Duration: 10 weeks. Design: randomized, double-blind, placebo-controlled. Results in the beetroot group: flow-mediated dilation, the endothelial function test, improved by 52% over the 10-week period. The placebo group improved by 9%. 52 versus 9. That is not a marginal effect. That is a structural difference in vascular health. Reinhard's protocol: 150 milliliters of cold-pressed beetroot juice, not from concentrate, consumed at midday with the main meal at least 2 hours from any antacid medication. If he had no antacid scheduled, I moved the beetroot to the morning alongside his watermelon. After 12 weeks, Reinhard's endothelial function test had risen from 3.1% to 5.8%, nearly doubling. His cardiologist called me personally. Now, here is what I learned after 22 years practicing urology that no medical school ever taught me. These 3 foods work independently. But when you combine them correctly, the effect does not simply add up. It multiplies. The Vascular Trinity Protocol. In 2023, researchers at the University of São Paulo in Brazil ran a pilot study specifically designed to test synergistic combinations of nitric oxide precursors in aging men. 94 participants, ages 65 to 80 years, 8 weeks, randomized into 3 groups: watermelon only, pomegranate only, and the full combination protocol. The combination protocol they tested used 200 grams of fresh watermelon flesh and rind, 100 milliliters of pure pomegranate juice, 1 heaping teaspoon of beetroot powder, and 200 milliliters of pure coconut water as the electrolyte base. Why coconut water? Because it is naturally rich in potassium and magnesium, two minerals that directly modulate nitric oxide synthase activity and prevent the vasoconstriction that counteracts everything we are trying to achieve. Results after 8 weeks. The watermelon-only group, 41% reported meaningful improvement. The pomegranate-only group, 38%. The combination group, 84%. 84 versus 41. The synergy more than doubled the individual effect. The proposed mechanism. Watermelon provides the enzymatic nitric oxide pathway via L-citrulline. Beetroot provides the direct nitrate to nitric oxide pathway. Pomegranate protects nitric oxide from oxidative degradation before it can act. Coconut water provides the electrolyte environment that stabilizes vascular smooth muscle response. How to prepare the vascular trinity. Step 1. Blend 200 grams of fresh watermelon including the white rind until smooth. Step 2. Add 100 milliliters of cold-pressed pomegranate juice directly into the blender. Step 3. Add 1 heaping teaspoon of high-quality beetroot powder. Step 4. Pour in 200 milliliters of pure coconut water, no added sugar, no flavoring. Blend for 30 seconds. How to take it. In the morning on an empty stomach at least 45 minutes before breakfast. 5 days per week, not 7. Give the body 2 recovery days to avoid desensitization of the nitric oxide receptors. Run the protocol in cycles of 6 weeks on, 1 week off. Do not add protein powder. Amino acids compete for absorption. Do not prepare the night before. Oxidation begins immediately after blending. Let me summarize what the science has confirmed, and what the pharmaceutical industry would prefer you never discover. Karolinska Institute, 2022, men with reduced nitric oxide bioavailability have 78% higher erectile dysfunction prevalence, independent of testosterone. This is a vascular problem, not a hormonal problem. Texas A&M University, 2023, L-citrulline from watermelon produced 67% improvement in erectile function scores in men with vasculogenic dysfunction over 12 weeks. Queen Mary University of London, 2022, pomegranate juice produced 38% increase in peak systolic velocity on Doppler ultrasound, a direct, measurable vascular improvement. Wake Forest University, 2023, dietary nitrates from beetroot improved endothelial function by 52% in men with cardiovascular comorbidities. University of São Paulo, 2023, the synergistic combination of all three achieved 84% improvement in erectile function, more than double any single food alone. These are not opinions. These are published findings. And there is no version of a pharmaceutical boardroom meeting where any of these results benefit anyone financially. The question you need to ask yourself is not, will this work for me? The question is, how much longer will I wait, when the science has already answered the question? As for Harold Chambers, he returned to my office 6 weeks after starting the Vascular Trinity protocol. He came in wearing a blue shirt. He looked different, not just physically. There was something in his posture. His Doppler re-examination showed peak systolic velocity had risen from 14 to 21 centimeters per second. His endothelial function test, from 4.2 to 6.6%. We shook hands. And then he told me, the wedding was scheduled for October. Mr. Harold Chambers, 75 years old, remarried on October 12, 2024. I have received messages from patients over the years that moved me. But the photograph Harold sent me from his wedding day, standing next to his bride, smiling in a way I had not seen when he first walked through my door, that one I keep. Harold is not an exception. He is not a medical miracle. He is what happens when a man's vascular system receives the precise nutritional inputs it has been missing for years, applied with scientific rigor, proper timing, and consistency. Your body has not forgotten how to heal. It is waiting for the right tools. If this video brought you information that genuinely mattered, information your doctor has never shared with you, subscribe to this channel right now and leave your like. Every week I bring new research-backed content on men's vascular health, hormonal function, and nutrition science that most physicians simply aren't discussing. Share this with the men in your life who need it. I'm Dr. Marcus Sullivan. Until the next video, and remember, the most powerful pharmacy in the world has always been your kitchen.